so he'll be doing the update not only for Mercy, but also for Dr. Mark Kerouac in Bay State. We appreciate that. I'd also like to thank our sign language professionals. Thank you very much for being here. And of course to my cabinet heads and rank and file and their families for their continued efforts to defeat this COVID-19. As I've said many a times, tested and true through a number of natural and man-made disasters. And thank you, each and every one of you, the residents of the city of Springfield and our business community, for your resiliency, your patience, your cooperation, and your understanding. Let's go to the stat sheet. Commissioner Helen Carlton-Harris indicates to me since this COVID-19 has started, total confirmed cases of 21,813. The monthly total finished up at 2,119. The weekly total was 425, a little bit of a decrease, which is good news. Now we are still technically in the red. We cannot be laxed. We need to wear masks when and where appropriate and follow the proper public health protocol. One thing that Helen and I want to continue to hammer away at you in a positive way, as does Dr. Roos and Dr. Kerouac, you need to get vaccinated. There is no excuse anymore. There is plenty of opportunity to get vaccinated. We've stood up a number of sites. We'll continue to stand up a number of neighborhood sites. And obviously we have Curative and Governor Baker's mass vaccination site at the East Hill Mall. That's the number one goal right now. Get vaccinated. Get vaccinated. That'll make it much more quicker for us to get these masks off, be able to give hugs instead of air hugs, and to move forward with our activities and our economy. So please, please, it's not only good for you, it's good for your health and your family's health too. Speaking of vaccination sites, late Friday afternoon, early evening, Helen and I were up at the Greenleaf Carlo Concepcion Community Center. The theme there was one and done. We did the J&J, and there was a nice crowd up there. They were very, very appreciative. That was in our 16 acres area. Helen and I will continue to work to expand neighborhood vaccination sites. Today we'll be making an announcement, again working with Dr. Sly Douglas of Curative and State Representative Bud Williams. We're going to expand with Home City Housing, Oak Grove area, so that's up in the square area, 16 acres area. J.C. Williams Community Center with Reverend Steve Williams. That'll be in the Six Corners, Maple High. We'll be announcing that. We continue to work very closely with BHN, Behavioral Health Network, with their sites. Caring Health Center, and I was by it very early this morning at the X, a Forest Park area. Lines out the door, which is very, very good. We will continue to stand up at the Raymond Jordan Senior Center. We'll continue to stand up at Bowen School. So we've kept to our word to give you convenience, to make you feel comfortable. So we need you to get vaccinated. Helen will go more into the totals of our vaccinations. We're nearing about 50,000 Springfield residents being vaccinated with that first shot. 32%, that's a little below the state average. We're behind there. We're decent on when it comes to counties. That's first dose. Full dose, we're hovering below 30%, about 28.7. We need to pick that up. Again, no excuses. The vaccinations are there for you. Quick and painless. So please, please, please get vaccinated. Please get vaccinated. On the deaths, I'm happy to report there have been none. So we stay status quo with total deaths of 246. 99 of those which are white. That's 40.2%. Black is 55, which is 22.3%. Hispanic is 85, which is 34.5%. Asian is 7, which is 2.8%. We've stayed very static on the status quo with long-term care facilities at 60 and residential at 186. The Oasis Food Bank, again, just to remind everybody, that has been moved and working with the Eastfield Mall up to the old Sears Automotive building, standalone building. Again, I want to thank John Foley and Sedesco, Food Bank of Western Massachusetts. They've been great partners along with my city departments. We're serving about 3,500 families every Friday. We continue our telephone bank assistance on vaccine shots. Very appreciative Health and Human Services team, Elder Affairs, and our library teams. I get a lot of good feedback from the residents who have called that needed a little TLC, tender loving care, to get their vaccine shot appointments going. Governor Baker continues his homebound vaccine shot program. Again, that's all on the website for homebound individuals. We continue to deliver meals to our seniors who are homebound. The Mass site continues with curative up at the Eastfield Mall. It's going very smoothly. Stop the Spread. AMR, Patrick Leonardo was Director of Operations. They have been fantastic partners, not only now, but before COVID-19. So the testing is going well up there. I'd like to point out on the very hateful disfacement of the Canaan Baptist Church sign. Spoke with Reverend Dr. W.C. Watson a few times, and we quickly were able to alleviate that problem. And I want to give a big shout out to my graffiti remover, Mike, aka the Eraser Cass, and Springfield Police Commissioner Cheryl Clapper, as we continue to work leads to catch the culprit and or culprits and bring them to justice. But Reverend Watson was so impressed. He thought that the congregation was going to have to raise money to get a new sign. And the eraser, Mike Cass, did a fantastic job. He lives this job 24/7, even on the weekends when I call him to get graffiti down. So I just don't understand some people in society why they would do that, but we dealt with it quickly. You can't let this stuff fester. You need to nip it in the bud. Speaking of AMR, we just did the 5th Earn While You Learn program. Many of those residents are Springfield residents who have taken full advantage of the program, and they're almost guaranteed a job with AMR, and they're also guaranteed, which I think is very, very important, that career ladder. We spoke to a couple Springfield residents of Tatiana, who's now going to move to a paramedic. And this all started, you're getting paid as you're being trained and learn, and you walk right into a profession. So thank you, AMR, for that program. To Helen and to Sandy Federico of our Elder Affairs Division, we just had a fantastic senior citizen car parade at the Ray Jordan Senior Center last week. The theme was fantastic. It was a circus theme, and there was absolutely fantastic costumes, games, giveaways. It was just really a feel-good event, and the camaraderie for our senior citizens, and we're hopeful to get them back in our senior centers as soon as possible. Also, congratulations to our national champs, Pope Francis High School. We celebrated that, giving them all proclamations and citations up at Pope Francis High School Hockey National Championship. First time ever for the city of Springfield. Brought greetings and congratulations to the Urban League 108th Awards Dinner. Community Builders, our very own Helen Colton Harris was one of the award winners. Arbor Day, we had a great celebration at Bowles School. Thank you, Principal Doty. Congressman Neal was there. We dedicated a tree. The kids did a great job. We dedicated a tree to former teacher. She passed away. She was beloved up there. Lynn Ainsworth and her family was up there. It was very, very heartfelt. Tomorrow I'll be touring our golf courses. Tremendous amount of improvements have been made at the golf course, especially the bunkers. I'm not much of a golfer, but I'm getting rave reviews. I want to thank Pat Sullivan and team and TJ Plant. We are very well versed with 2 top-notch public golf courses at a very affordable prices. I'll also be meeting with Bishop Dr. James Gill this week as he reached out to me to help on our continued attack on dealing with guns and gangs. Also, we're going to start to see what we can do with our landmark events, and I'll be meeting with the Jazz and Roots Festival, Kristen Neville, Evan Plotkin this week. Let's see what can be accomplished as we continue to move forward to knock down this COVID-19. That's a wonderful event. Brings a very beautiful, diverse mosaic of all of New England and New York here to the city of Springfield, with nationally known acts and local acts, the award-winning acts. National Day of Prayer. Never heard anybody to say a prayer. Will be again at City Hall steps. I want to thank Pastor Juan Feliciano. Always reaches out to me. That'll be coming up this week in the evening. To each and every one of you, don't forget, Sunday is Mother's Day. And to all our mothers, whether here or up in heaven, they always stood by us, so don't forget our mothers. So happy Mother's Day. Malacombe Bar and Restaurant has been a tremendous pain in you-know-what to the residents of our downtown area. I want to thank Licensing Director Attorney Alicia Days and the License Commission and our Springfield Police Department, Commissioner Clapper. That liquor license has been revoked. The entertainment license hearing will be held very shortly. And again, I'm all for business as long as you're operating in a respectful manner and following the rules and regulations. The residents have reached out to me. There's been constant issues, which are no good at any time. But these issues were occurring during COVID-19, a complete and utter disregard for public health and public safety. I'm not going to tolerate it, and we will continue to stand up for the residents of the neighborhood area. This week we're going to be marking Children's Mental Health Week, May 2nd through the 8th. We're going to be lighting up, and thank you to Union Station and Chris Moskal, Tim Sheen, and Attorney Tom Moore, Green, and also the parking garage there. Nicole Desnoyer, I want to thank her. She really brought it to my attention. And to those families that are dealing with that, there is hope out there and there is help. We want to make that known to people. I also want to give a shout out this past Saturday, the Springfield Trailblazers Basketball Club at a car parade. Congratulations and continued success on and off the court. A group of residents, Mary Ann Maloney and others, about a litter campaign, educating our students about the importance of not littering. I'll be meeting with them again, and Superintendent Warwick and others. We had started to look at that before COVID-19 hit, and trying to be proactive on the importance of not littering. More good news, the AHL, our beloved T-Birds, be ready to start their season October. Get your season tickets now. I look forward to seeing you in the stands. As far as the update, quick updates, Commissioner Clapper, Springfield Police is down 2 with COVID-19. It was a busy weekend, unfortunately. Kept our brave and dedicated men and women in blue moving around left and right and making arrests and quelling disturbance. Lead Street shooting, of course, and gang related. Dirt bike patrols continue. We made more pickups on dirt bikes and arrests. Police took at least 4 guns off the street this weekend. Major disturbance, Commissioner Clapper will speak of it, North End, Huntington Street. Really took a lot of man and woman power away to quell that disturbance away from my city areas. I'm not too happy about that, what occurred. Two of our officers have been injured in a chase, auto chase, and we think this pertains connected to the Dartmouth Street shooting. On that, and we will get you. We have more information on a car and weapon on that. Our DOJ meetings continue with Judge Ireland and DOJ officials and our city team. Great collaboration, great conversation and meeting with Secretary of Public Safety Tommy Turco and Commissioner Clapper. We continue. We have a fantastic partnership with our state police and Colonel Mason, Major Habel. We're going to continue our operation and working together in partnership to go after the gangs and guns. And the dirt bike patrols will continue. The eye in the sky will be out there. You don't know when, but it's going to be out there. So you want to keep riding those dirt bikes in the city of Springfield. We've been able to quell it a bit. I still get emails, but we're going to get your dirt bike, we're going to confiscate it, and we're going to arrest you. So don't do it in Springfield. Don't do it anywhere, but don't do it in Springfield. So that attack will continue. On the fire department, it was a quiet week, which is good. Commissioner Calvi indicates only one down with COVID-19. This Friday at Symphony Hall, the beautiful, majestic, historic Symphony Hall, we'll be doing promotions and award ceremonies with Commissioner Calvi. DPW Director Chris Signoli indicates to me nobody is down with COVID-19. Again, it's pothole season. Please call 311. Our pothole crews will get out there. Street sweeping continues. Yard waste pickup continues. Again, yard waste is picked up on your recycling day. Yard waste is picked up on your recycling day. We continue our outdoor dining assistance, whether on the Echo Dev side or DPW, 4th Street and Warrington Street. Paving has been done or being completed to enhance outdoor dining in those areas for our restaurants in the area. New street pavings, Director Signoli will speak of. The new street pavings will be starting as early as next week. We still continue, and I want to thank the media. We still always on the lookout for CDL drivers and traffic light technicians are needed. School Superintendent Warwick will have a lot to update you on. As far as the meals, we've now given out 7,262,799 meals. This weekend, 62,992. We're still going to keep sites from 4 to 6 in the evening. Schools have opened very well. Our test ratio, the COVID-19 test rate is very, very low, very, very low. High schools students will be going back May 17th full-time. Pre-K to K to 5 is full-time. They started all back today, full-time. Grades 6 to 8 will start full-time back next Monday, May 10th. And we'll have the final budget vote, another school committee meeting this week in the evening. Finance, my CFO, TJ Plan, indicates to me since this ordeal with COVID-19 has started, we have a deficit of $8.4 million. The current deficit for FY21 is $3.5 million. Currently being spent to help out our residents and business community, $38.1 million has been spent to assist our residents and business community. Of that, $29.5 million has been able to be pawned off the grants, leaving about an $8.7 million or so deficit. We continue our budget development for FY22 and look forward to making that presentation and giving it over to the City Council for the due diligence. Facilities and Parks, Pat Sullivan indicates to me nobody is down with COVID-19. He continues to work very closely with Commissioner Helen Carlton-Harris as we continue to expand and open up neighborhood vaccination sites. Thank you, Pat. Schools, again, have reopened very well. He's worked very closely with Superintendent Warwick and Commissioner Helen Carlton-Harris. And Pat continues his tremendous work, his team on grants work. Again, we're looking for the media for help. We are in needs. There are positions available for summer rec positions and for lifeguards. Again, we're planning to move forward unless something catastrophic happens, we're planning to move forward on summer rec and waterway areas, lifeguard efforts. On Echo Dev, Chief Development Officer Tim Sheehan indicates nobody is down with COVID-19. Tim will give you an update on the economic indicators, which seem to be good, which we're happy about. And again, I've always said I'd like to have a remake of the Roaring 20s and 1920s, but again, without the stock market crash of 1929. So we're already planning so businesses now get out of survival mode and get into thrive mode. We believe that we might be able to make an announcement as early as this week on the business technical assistance to our small businesses. On the HR labor front, again, updates from Attorney Bill Mahoney and Solicitor Ed Pakula. To Bill, congratulations again on your daughter's wedding, marriage this weekend. Congratulations. Our DOJ meetings continue. Solicitor Pakula, and the marijuana, recreation, cultivation, delivery review continues to move forward on new entrepreneurship of business. With that, I will bring up Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital Trinity Healthcare. His week this week, he'll do the update for Mercy, and he will do the update for Bay State Health Systems, Bay State Medical Center for Dr. Mark Caraway. Dr. Robert Roos.
Thank you, Mayor, for continuing to have these weekly updates, and good morning to everyone. Hope everyone's doing well this Monday morning as we move into May. I do want to recognize that at Mercy Medical Center and at health systems across the country, later this week on May 6th, we'll kick off National Nurses Week, which concludes on May 12th, which is an honor and recognition of nurses all throughout our system, throughout our community, and throughout the country that just provide incredible service to patients in all settings. Amidst a very, very challenging year, I want to give a very heartfelt thank you to all of the nurses at Mercy Medical Center and throughout Trinity Health of New England who have just been tremendous with their dedication, their compassion, and their skill. So thank you, and join me in recognizing nurses later this week. The news generally coming out of the United States in regards to the pandemic has been positive on balance. We've seen declining rates of new infections, hospitalizations, and deaths. We've seen more evidence accumulating regarding the effectiveness of vaccinations, and we've received some new guidance from the CDC that I'm sure has been a relief to many of you, including those particularly who have been vaccinated. To me, it's starting to feel like we are turning that last corner, so to speak. But the concern still does remain regarding the status of the pandemic on a global scale. Right now, India is suffering a surge of catastrophic proportions that is drawing attention appropriately from much of the world, as they are now reporting over 400,000 new infections per day, which is thought to even be somewhat underreported. Hospitals there are overwhelmed, oxygen is reportedly in short supply, and there are communities suffering significant impacts. To me, this is an urgent crisis for us all. We must remember that if we don't suppress the virus everywhere, it can emerge and rebound anywhere. I do applaud the efforts from the Biden and Harris administration to begin to send some supplies, including oxygen, PPE, and tests to India, as well as some treatments like quantities of remdesivir and vaccine manufacturing supplies that could make as many as 20 million doses. That's a small number relative to the population of India, but certainly it's a smart and essential contribution to supporting the overall global public health. It also highlights that we must continue to be cautious about threats of new viruses, new variants, and transmission of the virus across the globe, as well as in pockets of the United States, as it could come back to continue to impact us in the future. As of this morning, there's been over 152 million confirmed infections across the world. The number of new infections per day is actually at the highest point since the beginning of the pandemic, and it's continuing to rise. It's risen by 7% in the last 14 days, and even more concerningly, the number of deaths is also rising too when you look across the globe, and it's increased by about 13% in the last 14 days. The United States, on the other hand, has seen a slightly different trend, where we have now confirmed over 32.6 million cases, but all of our key metrics are decreasing over the last week. The overall numbers of new infections per day is now down to about 50,000, which is about 25% lower than it was 2 weeks ago. Hospitalizations are down 5% and deaths down 7%. All very good news. In Massachusetts, here where we've had over 637,000 cases, there is also continued promising news as the rates, hospitalizations, and deaths have all been trending down. The numbers of new cases per day is now at its lowest point since the end of October, which, as you will remember, was just the beginning of this latest surge that we've been experiencing over the last 3 to 4 months. We're now down to about 860 cases per day, and test positivity rates are down to about 1.5%. Hospitalizations are under 600 across the Commonwealth, and deaths per day have remained in the single digits for about the last month. All good news. I want to be clear that the positive news that we are seeing right now in terms of less infections, fewer severe cases, less deaths, and the planned resumption of some events and activities and the lifting of mandates is directly related to the increasing numbers of people being vaccinated. This is also a testament to the effectiveness of the vaccines that we have available. I want to be clear that we don't have to be at this moving target of herd immunity in order to see the impact of vaccines. We are seeing it now, and it's important that we continue to escalate that. If we didn't have these vaccines, or if uptake of the vaccines had been slower, I have no doubt that we would still be experiencing the surge that we started to see in the winter months. Instead, due to the vaccines, the numbers of hospitalized cases in our community here locally have started to move in the right direction. At Mercy Medical Center, the number of hospitalized patients with COVID has been about the same for the last 2 months. So we've been able to hold from any increases. It's fluctuated between 10 and 16. As of this morning, we have 12 hospitalized patients with 2 in the intensive care unit. And our test positivity rate has decreased a little bit further now to 4%. Bay State Health is also seeing a marked decline in the inpatient cases. Their total COVID volume went below 50 for the first time in over 6 weeks on Saturday. And as of this morning, it's reported there are 54 inpatients across their system, with 47 at Bay State Medical Center here in Springfield, 7 in the community hospitals, all in of which 15 are in critical care. According to Dr. Kerouac, Bay State Health's test positivity is now just below 4%, while they've seen a bit of a decline in their testing volumes, going from about 800 per day to about 600 per day. So, while it's clearly not the time to relax or disregard our protocols, there is some very good news. At Mercy Medical Center, we have continued to reinforce the same policies that we have over the last several months. We continue to allow 1 visitor in our emergency department, inpatient, and pre-surgical areas. We continue to test all admissions to the hospital and all patients before their procedures, and we are treating COVID patients in separate areas regardless of vaccination status. Bay State Medical Center has an important announcement today that they will be relaxing their visitation policies as of today, allowing one visitor per patient from the hours of noon until 8 p.m. Outside of those times, there continues to be exceptions, as there have been for end-of-life care and maternity care here at Bay State Medical Center. Of note, the community hospitals have been allowing visitors already for some time, so that change is implemented for Bay State Medical Center as of today. Regarding vaccines, we are proud at Mercy that we believe that over 80% of our staff has been vaccinated, or that vaccination is in process. We are also seeing more and more patients presenting to visits or the emergency departments or the hospital having been vaccinated now. There continues to be more and more real-world evidence now outside of those clinical trials that is proving the effectiveness of vaccination. Last week, the CDC released a report verifying 95% effectiveness in the prevention of hospitalizations amongst those that are some of the highest risk, people aged 65 or older. So the data from the clinical trials, which showed high levels of efficacy, are now being proven also in real-world, larger-scale trials post-vaccination. There is a lot of proof now about how effective these vaccines are. The concern that I have, I know that's shared by others, is that the pace of vaccination has declined somewhat over the last few weeks. Although all adults are now eligible for vaccination, the number of vaccines that have been administered across the country has declined over the past few weeks from a high of about 3.3 million doses per day to now about 2.5 to 2.6 million per day. According to the CDC, over 243 million vaccines have been administered. Over 103 million people have been fully vaccinated. That's 44% of the total population, including children, that have received one vaccine, 31% that are now fully vaccinated. That would represent, if you remove those under 18, 56% of the adult population having received one vaccine and about 40% who are fully vaccinated. It's progress, but we still have a ways to go, and there is some concern about the drop in the daily rates of vaccines. Now, there's been a lot of attention about why that might be. There are some areas, perhaps, that have experienced some shortages in supply. There have been challenges, including confusing processes to schedule appointments. There may be individuals who have difficulty getting to vaccines, where we need to be bringing vaccines to them. And then there is some ongoing concern for lingering hesitancy, particularly in certain communities. I'll state that here in Massachusetts, however, we are surpassing the averages across the country. We've administered now over 6.2 million doses, which represents over 85% of all the doses shipped here to the Commonwealth, and over 2.6 million people are now fully vaccinated. That's about 37% of the total population, including children, so significantly higher than the United States, and about 57% of the total population has received at least one dose. So we are a bit better than the national averages by a factor of about 7 to 8% of the population, but we still have some ways to go, as we've mentioned. At Mercy Medical Center, we continue to have appointments each week and receive an allotment for about 1,100 vaccinations. We are utilizing only Pfizer, and to date, we have provided about 18,000 vaccines, with more than 8,000 people having been fully vaccinated. At Bay State Health, on the vaccine front, they continue to receive their weekly allotment of about 4,500 doses of both Pfizer and Moderna, or Moderna combined. Recently, they had actually received several thousand doses of Johnson & Johnson that were given to Bay State on a one-time basis for residents of Hampden County because of the high rates of new infections here. So I want to announce for Bay State Health that there is a walk-in clinic for vaccinations today from 8 a.m. to 6 p.m. at their Holyoke Vaccine Center, which is located at 361 Whitney Avenue. That will feature the one-shot Johnson & Johnson vaccine, and there will be some other walk-in vaccine clinics announced in the coming days. I'll comment that what's been similar for both Mercy and Baystate Health's vaccine clinics and efforts over the last week was actually how many open appointments we still have. As you would recall, earlier in the campaign, when we would post new appointments at Mercy, they would be gone within minutes, and the same would hold true for Baystate. Relative to Baystate, when they posted about 3,000 appointments for first doses last week, less than half of them were taken after 2 days. Baystate began offering walk-in clinics for the vaccine late last week, and they will continue to do that later this week. So if you have any interest, you can go to the website baystatehealth.org to find the latest on walk-in clinics or make-in appointments. The same has been the experience at Mercy, where we've seen increases in cancellations or rescheduling, some no-shows, and even as of this morning, some open vaccine appointment slots. We both suspect, and the evidence that we have from hearing from people is that this is largely related to the increasing numbers of vaccines and the convenience of locations all throughout the community. People can now get vaccines readily, make appointments the same day or the next day, and all that's a good thing. We also suspect, though, that there may be some lingering elements of vaccine hesitancy out in the community, and we're just not seeing the same demand that we saw earlier on in the campaign. Right now, just to highlight that, just about half of the adults in Hampden County have received one dose, at least one dose, which is a little bit behind other places across the state where about 2/3 of adults have received one dose. So both Mercy and Baystate continue to send the message across multiple platforms with many different types of representatives that getting vaccinated is important for everybody. It is effective, it is safe, it is free. It's the best way that you can protect yourself, the ones that you love, and help us all get back to a more normal way of living. Along those lines, this past week we heard a lot of updates regarding the reopening timeline for Massachusetts and resuming life as we would wish. There was also some guidance on relaxing the mask mandates in public. All of these are good things as we emerge together. But I want to remind everyone that all of that good news, all of that progress continues to be predicated on vaccination. If the rates of vaccination slow down, if they're not sufficient to suppress infections in the community, with new variants emerging, we could see those advances roll backwards. It's happened before, and it could happen again. So I want to encourage you and your loved ones, if you haven't already, to roll up your sleeves for yourself, for other people, and for our whole community. Last week, Governor Baker lifted the mask mandate in public. If you are outdoors and you are able to be at least 6 feet away from other people that are outside your household. The Centers for Disease Control stated the same thing. Really, this is a recognition, after a lot of accumulating science, that the risk of transmission of the virus outdoors is extremely low when you're not in crowds with many other people. It's also a recognition that more people are vaccinated, and so there are less places for the virus to go unencumbered. The CDC went further also to state that fully vaccinated people can and perhaps should start doing some of the things that we had stopped doing earlier as a result of the pandemic, such as attending small outdoor gatherings, dining outdoors with people that are vaccinated or unvaccinated, or with friends from multiple households. And if you're fully vaccinated, you can feel safe doing that without masks. But if you are not vaccinated, you must continue to be cautious. Variants are circulating. You must keep yourself and others safe with masks on, whether you're with people that are unvaccinated or those with other households, as it's higher risk. I know we're all ready for those days. We're ready to sort of ditch the masks. We're ready to gather together, to shake hands with our colleagues, to hug our friends. The weather's getting warmer. We're all eager to have a more normal summer than we did last year. So I encourage you to take those steps. As a physician, as a son of a nurse, as someone who lost a family member to COVID, as someone who has seen families in the hospital grieve after the loss of one of their loved ones, whether it was a young person or an older person, as someone who works side by side with healthcare providers who have been exhausted mentally and physically from this very, very long year, and for so many other reasons, I urge you to stay safe, to be vigilant, sign up for vaccination if you haven't already. It's something that we can all do that has the power to impact so many people. Thank you.
Thank you, Dr. Lewis. I don't think the rest of us here, 22, Mike, Eric, 40, Paul. Matt, any questions for Dr. Lewis? Paul?
Doctor, the follow-up on vaccination rate in Massachusetts doesn't appear to be a supply problem at this point. There's plenty of vaccine, plenty of places you can get it, or even walk-in clinics that are available now. It seems to be a demand problem. Have we reached the point where everybody wants a shot, got one, and what do we do to get to the wary people who are hesitant about it?
I do think that it seems over the past week or so, the experience has been that there is more vaccine readily available in a short time frame than people that are interested in it in that moment. I don't necessarily think it means that we've reached everybody that is interested in vaccination, because there may be people for which there needs to be some different approaches in bringing the vaccine more to them as opposed to having a system set up where people have to go to the vaccine. That being said, I do think that there still is some lack of perhaps full confidence in the vaccines and or more efforts that need to be done to tip the balance for some people who may just be ambivalent generally or not see that it's particularly important for them personally to get vaccinated in this moment. My approach in those cases really is always to continue to try to send the message from people that they trust, that the vaccine is safe, it is effective, and it really holds the keys to us getting back to the things that we wish. And understand what their motivations are so we can address any messaging or conversation to those concerns and or those hesitations. Aside from that, I think continuing to look at what other pockets of people, perhaps the homebound, perhaps some others, who may be interested if they had some more direct outreach, and then target efforts accordingly.
Assuming that people trust their personal physician, it'd be helpful to get more vaccine into physicians' offices. I mean, I know there are logistical issues because of the refrigeration requirements, but is that a strategy that you think would be productive?
I personally do. I think we will be looking at providing vaccines for this version of the coronavirus or future variants of the coronavirus, likely on an annual basis going forward. And as much as we can set up systems that make it as easy, convenient as possible, which to me includes provider offices, pharmacies, stand-up clinics, and then ways to provide mobile services into some hard-to-reach areas for those who may not be very well connected to the healthcare system or those that are homebound, would be an effective approach, or would be something that I would look to, absolutely. I do think you will see over the coming months less of the big clinic sites and a more distributed model, as long as we have the vaccine and the storage, capacity to be able to manage that.
Yeah, in fact, the governor announced this morning we are going to phase out some of the super sites in June.
Okay.
We are moving towards a more localized model. I assume that's something.
Yeah, and
it's now that you've read.
that is something that individually and personally at Mercy Medical Center, we are also looking at. We are not changing our model for the short term in the next few weeks, and we will continue all of the doses that we have scheduled, of course, but looking at a potential to translate into a model where the provider offices are doing more of this, particularly as we look to the summer and the fall.
Any other questions or comments?
Just out of curiosity, with the decline in demand, there hasn't been any reduction in waste on vaccinations, so efficiently being used?
Yeah. Yes, my understanding is yes. Certainly at Mercy Medical Center, the vaccine that we've been receiving, we still have been utilizing within 10 to 14 days, which was the state expectation. As we saw the numbers start to go down last week, we have the ability with the Department of Public Health to put a hold on a week's supply just so that we can utilize what we have within the appropriate time frame. So there has been no additional waste that I have been aware of, certainly not at Mercy, but more about recalibrating what the true need is from a demand perspective.
And you kind of discussed this a little bit in your remarks, but I mean, would you describe your institution as kind of more or less completely off, more time frame that, you would argue that it's possible, or even as last spring, there was definitely a tenser situation throughout the winter. Is that more or less over, and what's the capacity, God help us if we're going to back in this situation and scale that back up quickly?
So, at Mercy Medical Center, we had developed, big, robust surge plans that had tiers of escalating capacity that involved pulling in staff from different areas and so forth. And we have been operating in what we call our level 1, which is really our basic surge plan or our basic capacity plan, now for many months. We have not needed to escalate that. There was a period of time in January where we had looked at needing additional space in the hospital or needing to use additional resources, but that hasn't been the case in several months. I really think the sort of mentality from a staffing and hospital perspective shifted once we were able to really vaccinate our staff in high numbers, and we started to see more people in the community, particularly those that are higher risk, also vaccinated. The level of concern, I think stress, fatigue began to relieve itself just a little bit when people that have been on the front lines caring for very sick people within this emerging infectious disease threat felt protected, not only by the processes and procedures and PPE in their teamwork, but also by a very effective vaccine. And I think psychologically, that's had a tremendous impact on the mentality of our staff in a very positive way. If we were to see increased surges again of COVID, I feel confident that our team would pull together. We would be able to develop those capacity plans to increase. But right now, I think the important thing is that we are starting to see people come back into care for the things that they neglected, that they put off, that perhaps could have created more negative consequences for them. And those are the people that right now we really encourage to come out for care, to see your doctor, to seek urgent or emergent care if you need it, and to resume those things. Because missing out on the screening, missing out on those follow-up care, that has been a big concern for us, and we're seeing more volume emerge along those lines, which is a positive thing.
And just, I remember asking this last year, I don't remember if it was when you had a previous surge line or whatever, but the impact, the mental health impact of this is almost certainly long exceeding the physical implications of this. What are you seeing, what do you need to do in terms of prepare for that, in terms of, what you're seeing as a physician who deals in this area, particularly that going forward, assuming that this is the worst of the physical is perhaps
Sure.
behind us.
Yeah, this is going to be something that we do deal with for a long time. We know now the pandemic has caused more tragedy regarding behavioral health and addiction conditions. We saw the rates of overdose go up over the last year for the first time in many years after successful policies and practices to reduce overdose deaths. We're seeing increases in depression and anxiety. I really think, to me, it has highlighted that the most important thing that we can focus on from a health system is on our colleagues and their well-being. Supporting them with tactics for resiliency, providing opportunities for connection to mindfulness activities that can build coping skills and support them with doing difficult work. And from a community perspective, I think it's going to be a call to action for all of us to address urgently that behavioral health is impacted by and impacts all other medical conditions. We know this, we've known this for a long time. Depression can impact heart disease and diabetes. Substance use impacts all sorts of other medical conditions. But now we're actually seeing that link in ways that people classically in the past hadn't put together. An infectious disease now causing potentially a behavioral health epidemic as we move forward. So I think it's a call to action that those consequences are always in the forefront of our minds. In our interventions, from a public health perspective, fully integrate people's behavioral health needs into everything that we do. So there will need to be investment into how we integrate and support and treat for quite some time as a result.
Any other questions or comments, Dr. Roos? Okay, here again.
Thank you, Mayor.
Thank you very much.
Thank you.
Good health to you and your family. Thank you to Mercy Hospital. As we look to bring up Commissioner Helen Carlton-Harris, again, you heard from Dr. Roos, and Helen and I have said the same thing. To get vaccinated. Where we're finding a little hesitancy or people feel that they're invincible is our young people. That's the target group. Helen will speak more of that. We need our younger people to get the shots in the arms and get vaccinated. You are not invincible. And again, with Dr. Roos, Dr. Kerouac, Helen, my whole city team, we've coordinated very closely with our hospitals, so we did not face a surge where we could not handle it. So it was a team approach. Without further ado, the Commissioner of Health and Human Services of the City of Springfield, Helen Carlton-Harris.
Thank you, Mayor. Good morning. The data for the City of Springfield for this past week is as follows. The cases by day: Sunday 51, Monday 36, Tuesday 43, Wednesday 108, Thursday 34, Friday 65, and Saturday 88. Cases by age: 0 to 10, 80, 11 to 20, 99, 21 to 30, 70, 31 to 40, 88, 41 to 50, 39, 51 to 60, 29, 61 to 70, 12, 71 to 85, 81 to 93. That totals 425 cases for this past week. That is 79 cases less than we had the previous week. The cases by age group: 30 and under, 59%. That is an increase of 7% over our last week. 31 to 50, 30%. That is an increase of 2% over last week. 51 and older, 11%. That is a decrease of 9%. And so, as Dr. Roos talked about, one of the reasons that we truly understand that the vaccinations are working is in that 51 and older age group. 11% is the lowest that I have seen in that age group since the beginning, I believe, of this pandemic. That age group, 51 and older, are the age group that was first vaccinated. We began with those individuals who are in our nursing home facilities. And as you know, the deaths have lessened. We are seeing less individuals in our long-term care facilities dying, and that's directly related to vaccination. So the evidence around vaccination efficacy can be seen in the numbers of those who have been vaccinated. The cases by zip code: 01, 3 cases, 1%; 03, 9 cases, 2%; 05, 34 cases, 8%; 04, 92 cases, 22%; 08, 71 cases, 17%; 09, 106 cases, 25%; 18, 23 cases, 5%; 19, 28 cases, 7%; 28, 2 cases, which is 0%; and 29, 9 cases, which is 2%; and 51, 12 cases, 3%. There are those zip codes in our area who are doing extremely well, and I want to take the opportunity to thank you. The positive cases that we are seeing in the city are coming from institutions of higher learning and small gatherings. We continue to ask individuals who are having neighbors or family in their homes, if it is not your nuclear family or someone who has been in your environment, please keep your face covering on and protect yourself. The small gatherings in household continue to fuel this pandemic in the city of Springfield. The line graph in March, we ended with 1,771 cases. In April, we had 2,119 cases. In April, we had a 348 case increase than we had in March. Race, ethnicity, the other category is 24%, Black African American 16%, white 34%, and unknown 24%. If you recall, the other category I am leaving at this point truly as others because there are data that's being reported to us that we know is not correct as far as race is concerned. How do we know that? We do the contact tracing. And so we are able to call those individuals, and when we call them, we get the true race, and it is not other. The deaths the mayor has reported, we have no deaths that we are reporting right now. The vaccine report, as of April the 28th, 79,996 residents in the city of Springfield have at least had 1 dose. The state has dosed 5,912,233 residents. The first dose in the city of Springfield, 49,942. That is 32% of Springfield residents. Massachusetts overall is 3,681,397. Again, this is as of April 28th. That is 52.9% of the Massachusetts population. As you can see, the city of Springfield is lagging behind as far as that data is concerned. Springfield fully vaccinated individuals are 20.7%. The Commonwealth fully vaccinated is 35.0%. In the age categories, 0 to 64, 25.6% of the residents in the city have been vaccinated. For the state, that number is 45.9%. Again, we are lagging behind the state average. In the 65 to 74-year-old category, 75.6% of those individuals have been vaccinated in our city. For the state, it's 86.9%. For the 75 and older age category, 74.2% of Springfield residents have been vaccinated. For the state, that is 86.9% have been vaccinated. Race, American Indian, Alaskan Native in Springfield, 16.8% have been vaccinated. For the state, that number is 31.7%. In the Asian community, 32.8% in Springfield. For the state, that is 48.4%. Black, African American, 23.2% in Springfield, 34.5% for the state. Hispanic, 16.7% in Springfield, 30.1% in the state. Individuals who identify as multiracial, 14% in Springfield, 58% in the state. Native Hawaiian Pacific Islander in Springfield, 58.7%. In the Massachusetts, it's 71.5%. So as you listen to that data and you listen to the disparity between the median for the Commonwealth of Massachusetts and our numbers in the city of Springfield, you can see that in each one of those categories, as far as vaccinations are concerned, we are certainly lagging behind. Therefore, the city of Springfield, in conjunction with many of our community partners, will begin our effort to focus on the 18 to 35-year-old group. We will be announcing some initiatives shortly that we will undertake to try to educate, communicate, and relate to our younger population, stressing the real concern we have for their health, for the health of their families, and that we want them to certainly consider being vaccinated. So please stay tuned for our announcements that will target our 18 to 35-year-olds. I want to thank our vaccination partners who are doing an excellent job. They are just the staple of who we are as a city, and their work is invaluable. But it is also important for us to recognize that we must stay vigilant as far as vaccinations are concerned. All the reasons have been given. They're very compelling. We have told you over and over again the effectiveness of vaccination. We have asked that you get vaccinated, and we will continue to put that message out there. So thank you to AMR. We want to thank the Perch UMass students, the AIC students, Springfield Public School nurses, the MRC Medical Reserve Corps, thank you. The Western New England Pharmacy students, thank you. The Springfield Department of Health and Human Services, and the amazing staff that I get an opportunity to work with on a daily basis, thank you. The city of Springfield is experiencing the same challenges that Dr. Ruth spoke of as far as our appointment slots not being at capacity. We do have many clinics that will be stood up this week. We are hopeful that individuals in our city will take advantage of them. Our scheduled clinics are at Ray Jordan Center this week will be a second dose clinic. We will schedule a clinic May 5th, J.C. Williams, May 5th, Behavioral Health Network, May 7th, Greek Cultural Center, May 14th, Greenleaf, Tuesday the 18th, Ray Jordan Center. We have plenty of opportunities for our residents to get vaccinated. We have very specifically, very purposefully put these clinics in the neighborhood. That is what we heard from our residents. You wanted the clinics closer to your neighborhood so that you could access them. We are making that happen, but we cannot make it happen without your participation. We will also be announcing our partnership with Uber. We will be able to help our residents get to the vaccination site. That system, I believe, is in place and we will be announcing that on our website as well. So we've worked on the transportation, we've worked on the neighborhood clinics, we've gotten information out there, written and have done PSAs, and we'll have billboards. We are doing what you've asked us to do, but what we need from our residents is for you to work with us and comply by getting vaccinated. Again, we are continuing to have positive cases. My staff is continuing to do contact tracing, continuing to talk to you about isolation and quarantine, continuing to give you the information that you need to be safe. We understand COVID fatigue. Each and every one of us who comes before you has some experience in COVID fatigue, and certainly have had family members who have been COVID positive, as well as co-workers. This virus has taken its toll on a generation of individuals throughout the world. So what we are asking is that you consider getting vaccinated so we can walk out of this hand in hand together. And that's only going to happen when we reach a place where individuals are vaccinated and or we reach herd immunity. So we look forward to announcing some of our latest campaigns for the 18 to 35-year-olds. We look forward to making announcements about other neighborhood clinics we're opening. Again, we're doing what you asked us to do. What we need is you to participate with us in partnership. We cannot do this without our residents working with us. Thank you.
Thank you, Commissioner Paulton Harris. And again, heed her advice. When we were up at Friday, late afternoon, early evening at the Greenleaf Colorado Concepcion Center, you know, we're targeting, we have to get to our young people, 18 to 35. That's where the numbers are exploding, and that's where people, the young people, think they're invincible. And we try to tell them, do you want to be the one that takes that home to your mother, your father, your grandmother, your grandfather, sister, brother, any other family member? And it was a nice interview done. It was a young African-American male who I asked if he would do an interview, and he did. And he hit it right on the head. The one and done, the Johnson & Johnson, the J&J, he goes, I'm doing this, not really for myself too, but for my family. I babysit my young niece twice a week, and I want to make sure I don't take anything home to her or my family. That's what it's all about. So the vaccine is there. We're putting the neighborhood clinics together. We continue to expand them. We made it very, very simple, very, very easy. Please, please, we urge you to get vaccinated. There's no more excuses now. You want these masks off? You want to be able to socialize more? You want to be able to go to events? You want to be able to give hugs? I gave just a left hand there. Shots in the arms. That's what we need. We'll now go to the public safety component, and I will bring up Fire Commissioner of the City of Springfield, Bernard B.J. Calvi. Thank you very much.
Thank you, Mayor. Good morning, everybody. This week at the Springfield Fire Department, we have one person out with COVID. I'd like to thank the firefighters for their continued hard work in trying to keep the infection rate down at the fire department. Also this week, it is International Firefighters Week tomorrow, or International Firefighters Day tomorrow. So if you see a firefighter out there, thank them. That's all I have for this week. It was a quiet week last week. Have a great week.
Thank you, Commissioner. Thank you, Mr. Calvi. And now we'll get the public safety update from the police perspective. The Police Commissioner of the City of Springfield, Commissioner Cheryl Clapper.
Thank you, Mayor. The police department currently has 2 employees out with COVID, and I am stressing, please, to all the women and men in blue, please get vaccinated. These infections are not coming from work-related incidents. From what we can tell, it's from home gatherings. So please get vaccinated. We had a very busy weekend. It started Friday afternoon and it kept going. Friday at 4:30 in the afternoon, we seized another illegal dirt bike and we arrested the unlicensed juvenile rider. We'll continue to do the dirt bike program and we'll continue to press hard to seize bikes and arrest offenders if there's an illegal offense. Friday around 6:45 p.m., narcotics detectives executed a search warrant on Blanding Street. They seized 2 firearms, including an Intratec 22, which is on the mass assault weapons ban list. 38-year-old Daniel Perez was arrested. We seized cocaine and over $2,000 in cash. Friday night, 9:25 p.m., C3 officers arrested 19-year-old Ramon Quinones, recovered a loaded firearm after responding to a quality of life call in the Orchard Street area. Saturday, it starts again, 7:30 p.m., officers responded to a large disturbance on Huntington Street. This disturbance began over a parking space and just kept going as more and more people came out. Officers had to call for assistance. In total, 4 arrests ended up being made. 23 officers end up responding to this call, taking them away from the normal patrols anywhere from a half an hour to 2.5 hours as the disturbance just kept happening. Saturday at 11:50 p.m., officers responded to a shot spotter activation on Leach Street. 2 23-year-old male gunshot victims were located with serious injuries. One, I think, is in stable and one is still in very serious condition. Officers located over 30 shell casings. The incident takes less than like 3 seconds and over 30 shots are fired. Sunday afternoon at 5:45, detectives recovered a high-capacity firearm loaded with 22 rounds. The clip was capable of holding 30. The weapon was found on Merrimack Avenue, and we believe it was tossed there after a short police pursuit. Officers had located a vehicle that was wanted in actually a Dartmouth Street shooting from probably about a month ago. Tried to pull over this vehicle. He stopped when officers exited their cruiser. He took off again. It was an on and off again pursuit in which at one point on Bay Street, one of the cruisers was sideswiped. The vehicle that did that did not have a left-hand mirror, and he was avoiding a pothole. And he hit the front of the cruiser, pushing the cruiser into oncoming traffic. It was struck by a Ford F-150. The cruiser's totaled. Both officers went to the hospital. I am told they have since been released, cuts, bruises, and a possible concussion. But the officers located that vehicle afterwards, parked in the CVS St. James and St. James. It was unoccupied. The DB now has this vehicle, and we will check the vehicle for prints or DNA and see if we can find out who was operating that vehicle and who threw that weapon. Next week is Police Week. It's recognized nationally. We will have some events going on at the station and elsewhere, and we would ask that in tough times for law enforcement, especially your local police officers, we get support, but it's deeply appreciated and needed now more than ever with everything coming down on what the police do, and yet the women and men of the Springfield Police Department continually put their lives on the line and try their best for the city and for the Springfield Police Department. So if you see one of the officers out and about, any recognition is greatly appreciated. Thank you. Thank you, Mayor.
Thank you, Commissioner. Thank you, Commissioner Clapper. We'll now get an update on our Springfield Public School System and Superintendent Deanne Warwick.
Thanks, Mayor. Good morning, everyone. Our meals program has been ongoing, so even though we're going to be fully reopening all of our schools in the next 3 weeks, we're going to continue our meals program in the evening for the students who are still learning remotely, which is going to be 50% of our students. So we're going to keep sites open all throughout the city. We're going to keep posting the sites, but we'll have one in every major neighborhood. Since we've closed last March, we've provided 7,262,799 meals to families And this weekend alone on Friday, we served 62,992. So that's been very successful. We have our full program going for the kids who are coming into school, and for other families, again, they can pick them up 4 to 6 in the evening, and it's been very successful. Our COVID positive report that we submitted to the state for last week, for our live in-person students, we had 6 students and in-person staff, 3 staff members who had COVID. So very, very minuscule percentiles. So everything is working really well. I think all the work on the ventilation systems and all the COVID protocols that we're following are working well. And the kids who are going back to school are thrilled to be back in school. So it's going well. Last week, we opened 7th and 8th grade hybrid. Starting today, our pre-K to 5th graders are returning to full learning, so 5 days a week. Next week, on May 10th, our 6th to 8th graders will go in full. And May 17th, DESE announced last week, all the high schoolers in the state are going back full. So that'll be Monday the 17th. They'll be coming back in full. There's no opportunity for a waiver to start hybrid at high school. It's pretty late in the year, number one, and from a space perspective, only 30 to 40% of our high schools, I think, will return full, according to the surveys we've been doing. Most of them are going to finish the year remote, so we're going to have plenty of space. We have started our spring sports, and thanks to our health commissioner, Helen Colton Harris, we did all the testing. We only had 2 positives, and we're able to get our spring sports going. So that's, again, our kids are just thrilled with that. Our sports program is so important for our kids in many, many ways, but as an illustration, we had 2 Central High School students, 2 brothers, Joe and Josiah Griffin, get scholarship offers. Joe got a full boat offer to Notre Dame, BC, and 2 other Division I schools, including UMass. His brother Josiah, who's only a sophomore, already has a full boat to BC. So our sport program is about a lot of things other than just sports, and it's opening up a lot of opportunities for our kids. So it's so important. The kids are just thrilled after being out of it for so long to be able to participate in the sports. With the support of our health commissioner and Patrick Sullivan, we've planned all our graduations, all the DESE guidance was pushing it towards outdoor. We're going to have full graduations at Central High School on the football field. Working with our health commissioner, we're going to have all the COVID protocols in place. And Pat Sullivan from the park department has been helped us to procure stages and everything and sound systems we need to make it a really nice ceremony. So we're really pleased with that. MCAS testing, which was very controversial, seems to have settled down now. The commissioner gave us some concessions on the MCAS testing. Our 11th graders are not going to need it for a competency determination. But they can take the test because many of our kids get the John and Abigail Adams scholarships by taking the test. So they can come in and take the test if they'd like. But they're not going to need the test to graduate. Our 9th and 10th graders are, and we're opening the schools and providing an opportunity. And they have to come into school if they want to take the test. They have to come in and take it live. Our grades 3 to 8 students, we're going to be offering the test in school for the kids who are returning. But for the kids who've stayed remote, they can take the test remotely because it's not part of the competency determination. So for parents, they can get the test in either way. And what the commissioner did was he cut the testing program in half for all the students, so there won't be as much time testing at the different grade levels. That's all I have. Thank you, Mayor.
Thank you, Superintendent Warwick. We'll now get the update from the Department of Public Works. Director Chris Signoli, please.
Mayor, thank you very much. The DPW has no employees out with COVID. With regard to the sidewalk seating program, the work on Fort Street is complete. And I have heard from the owners that they will be starting installing all of their tents this week. Worthington Street is ongoing, will probably take another 3-4 weeks. The Central Street project last week did a significant amount of paving in the Hickory Allen area, so that project is moving along. Bay and Berkshire Cottage and Harvey are ongoing as well. Residents with potholes or sidewalk issues, please continue to call 311. And our street sweeping program posted on our website every Monday or Tuesday is what we will be doing for the next 3 weeks. Lastly, this week is usually the week we start putting out compost for residents up at Blunt Park. That has been put on hold. The DEP is requiring a lot of testing of the material up at the landfill. We had the fire there last year, and apparently there was a significant amount of foam used throughout the area, so they're going to be doing some testing. So hopefully in the next couple of weeks we will be able to start delivering compost for residents. That is it, Mayor. Thank you.
Thank you, Director Sigali. We'll now go to the update from Facilities and Parks, and Director Patrick Sullivan, please.
Thank you, Mayor. We have 0 out with COVID. Over the past few weeks, I've been working with our Health Commissioner and developing site plans, and we are going to be working with her to open up the J.C. Williams and the Greek Cultural Center. And I just want to thank the management of both of those locations for their cooperation. And I would have to say, everywhere Helen and I have gone, everyone has been very gracious and wanted to assist the city. I also want to thank the residents for complying with our COVID applications. Helen and I meet every Monday at 1 after this announcement, and we go through roughly 10 to 12 applications for residents wanting to hold events, and that process is working out very well, and we appreciate your cooperation. And then last, we have positions available, working with our HR department, Bill Mahoney and his team. There for summer enrichment, we have rec leader positions, head rec leaders, and lifeguard positions. So we encourage everyone in the city who is 16 years of age or older interested in this type of work to please sign up, as we want to start interviews in the next 2 weeks. Thank you.
Thank you, Director Sullivan. And now we'll go to Echo Dev and Chief Development Officer Tim Sheen. Again, we're in the business of doing business, and we're getting ready to move from stabilization to being able to thrive. Chief Development Officer Tim Sheen.
Thanks, Mayor. Development Services has 0 folks down with COVID. We had some great economic news last week. Gross domestic product rose to 6.4% in the first quarter. Driving the gain were increases in consumer spending, non-residential fixed investment, federal government spending, residential fixed investment, and state and local government spending. Another sign that the economy is picking up strength after the soft start in January. As I've indicated previously, we have seen a sharp improvement in consumer confidence and declines in jobless claims, which furthers the positive economic narrative. On Wednesday, Federal Reserve Chairman Powell acknowledged the economy had strengthened and also that inflation was rising, although he said the Fed has the tools to manage the transitory increase brought on by supply chain constraints and government tariffs. Economists are indicating that the stimulus bill not only saved the economy, but it brought it back to where it was before the economy shut down, and that we will likely wind up with a higher level of activity going forward than we had pre-pandemic. Many sectors are operating at historic highs. Home prices are appreciating at the fastest rate in 15 years, and the stock market is reaching record highs. The unemployment rate has steadily trickled down to a national level of 6% from its pandemic high of 14.7%. The service sector, which consists of jobs that workers meet customers face-to-face, has picked up as business restrictions loosen. Half the population has received at least 1 vaccine dose. This is a far more optimistic economy than we thought we would have a year ago. On Friday, senators pressed the Treasury Department to provide guidance to states and cities on the specific section of the American Rescue Plan law that aims to ensure relief funds are directed towards essential workers, services, and investments. The city has similarly sought such guidance from Treasury and remains hopeful such will be coming by mid-month. As we appropriate these funds, we want to make sure that our investments meet the needs of our local economy and that we have invested wisely in projects that promote economic sustainability. As the mayor indicated, the Business Technical Assistance Grant announcements are expected this week. Recipients will be working in close collaboration with the Springfield Regional Chamber of Commerce. Thank you.
Thank you, Director Sheehan. I gave you a brief update pertaining to our financial situation from CFO TJ Plant and from Labor, HR, and Law, and Attorney Bill Mahoney and Solicitor Papula. So with that, if there's any questions or comments, my cabinet heads and myself will entertain them. Paul?
Question for
Helen?
So Governor Baker announced this morning as part of a shift in strategy to try to reach people who have been hard to get vaccinated, that they're going to double the amount of vaccine they're giving to the 20 most impacted communities in Springfield. Do you have the capacity to distribute double the doses that you're getting now? I don't know exactly when you're going to do this, but that was the announcement this morning.
The city of Springfield does have the capacity to use additional doses, but I think what you heard today from Bay State and from Mercy is that there are slots available that are not being filled. We are having the same experience in the city of Springfield. We have a number of links up with a number of slots that are open that are not being utilized. So we certainly can expand for extra doses. However, we need the public to cooperate and to want to get those extra doses.
So what's your strategy for trying to get people to come be vaccinated?
We have a number of outreach strategies. We have individuals who are going door to door, full PPE, but going door to door. We have individuals who are visiting specific areas of the city to do outreach. We continue to reach out to the hardest to reach population. However, again, we will be targeting the 18 to 35-year-old with very specific events, very specific outreach strategies, kind of trying to play to what we know is important to them and being able to have a conversation as well as activities.
Just wanted to follow up on a couple of things. First, I just want to clarify, you said that you're reading the percentages of the numbers of how many people got first dose in Springfield versus statewide. What was that number again in terms of Springfield? Because it's not, I wasn't sure if it was 79 or 70,000 that got one dose. Yes.
49,000.
The mayor's saying, I can walk over and get my paper, but if you'd like me to do that, I'm happy to do that.
I think it was about over 49,000. First.
Okay.
Let me go to after Helen. Let Mayor Helen.
So the overall report did say, vaccine report as of April 28th, 79,996 Springfield residents received at least one dose. And then it breaks it out by first dose, 49,942, and then partial dose is another number, which I believe is 17,641. The fully vaccinated number is 20.7%. For the Commonwealth, it was 35.0%.
Thank you, appreciate that. Is the city itself tracking any breakthrough infections at all, or is that not something that you're
Any break?
people who vaccinated but then test positive afterwards?
We do not have that data for the city of Springfield.
And I noticed that there was a little bit, it's maybe, statistically not very significant, but there was a little bit of uptick in cases that had the Ludlow jail the last couple of weeks. And I was just curious if people are test positive there while incarcerated, they are a resident of Springfield. Does that come back to your data, or is that kind of separate entirely from what you're receiving?
I believe that data is held in Ludlow, but it's also held as a separate data set so that the DPH knows that that infection rate is related to the Hampden County House of Correction. But again, here in the city of Springfield, as the data tells us, 89%, is it 89% of our cases are under the age of 50? Amazing. So that data does not include any individual who may reside outside of the city but would come back into the city. However, our relationship with the Hampden County House of Corrections, we certainly know who those individuals are and if they are released, what neighborhood they're released to, who is their primary care provider, so we can then have the conversation and follow up.
And just finally, on the mask mandate changing statewide, does the cities automatically change the states? I know that some municipalities in Massachusetts, where you have chosen to make theirs a little bit different, but is ours just like, you know, a state school and it's changed, or you have to actually like change the order itself? Like how does that, it is really technical, like how does it work since the city does have its own layer of rule along with the state?
Yeah, there were 2 municipalities, as you know, who decided not to follow the governor's guidance around the outdoor fully vaccinated mask mandate. We in the city have chosen to follow the DPH recommendation. However, I would say common sense and good judgment is critical. We know that we are still a red city and individuals should behave accordingly. So from a policy perspective, we follow DPH. From a practical perspective, we ask our residents to use common sense, good judgment, understand we are still in the red, and please act accordingly. On what? I am very happy to update you on that. Thank you so much for asking. I've been waiting for that question all day. I am in the process of having conversations around basketball hoops and when we can safely reopen them. I am not ready to make an announcement right now as far as basketball hoops are concerned. However, I will be, within the next couple of days, with the mayor, be making an announcement as far as basketball hoops are concerned, our reasoning, our rationale, and our timeline.
Thanks, Commissioner. Any other questions or comments? Again, I want to thank the media, TV, print, and radio for getting out this pertinent information. We appreciate that. And I want to thank again the residents and the business community of the city of Springfield for your patience, understanding, and cooperation. Helen and I and Dr. Roos and Dr. Kerouac and the cabinet heads do need a little more cooperation when it comes to getting vaccinated. Helen gave you the statistics. I believe 80-something% 50 and under, but when you really zero it down, 35 and under is 57%. And that's key. Our young people at times think they're invincible. We need you to get vaccinated. If you're not thinking of yourself, please think of your family members or people that are close to you. You don't want to take the COVID-19 coronavirus pandemic home to them. So I think our major word here today, or major phrase, is get vaccinated. It can be as simple as the J&J, Johnson & Johnson. Our credo is one and done, baby, and you're done, you're out. Or you have the Moderna, no excuses. You have the mass vaccination site at Eastfield Mall, but we have numerous neighborhood sites that Commissioner Colton Harris and I and our partners have opened up to make it extremely simple and easy for you. We're going to continue our outreach, we'll continue our PSAs, we'll continue our social influencers. But to the young individuals out there, just remember what I said earlier with that young man, African-American male, nice kid, at the Greenleaf Claudio Concepcion Center. He said, Mayor, I'm here. You know, besides myself, I babysit my niece, my young niece, twice a week. I don't want to bring anything home to her or my family members. So please, 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 get vaccinated. Sooner you do, the quicker the masks will come off, the quicker we're going to be able to give hugs instead of air hugs, have events, recreate more, get vaccinated, please. So, to each and every one of you, good health to you and your families, and go out and have a great day. God bless you. Thanks.